Ladies and gentlemen, please direct your attention to the stage for a discussion on the social determinants of health.
Okay. Whoa,
No.
I'm quite loud. How were the working groups? Were they good? Great, great. So what we're going to ask you to do throughout this time together is to perpetually ask yourself that question: what would, in whatever issue area we're looking at, what would a children's first agenda look like? How would things be different if we put kids first? And this is a set of panelists who've been doing just that, putting kids first. I think one of the most striking things we know is that one of the key best indicators, best predictors of health outcomes is the zip code in which you live. And that is both a horrifying indictment to know that we would allow anyone to not have the same opportunity for great health outcomes. But it's also an indicator that this is something we can do something about. It's an addressable problem. And so we'll be talking to three exceptional leaders who've been thinking through how to address that problem. But if inequality, Billy, and you know who you are, you know who they are, and they know who they are. So Billy Shore, Mark Shriver, Erwin Redlener, and I'm going to start with you, Billy. You founded Share Our Strength. And if it is true that inequality is at the heart of some extraordinarily negative health outcomes, what would equality look like? What are the impacts of poverty and inequality?
I think it's a great question. Jane gave me a heads up just as we were walking in that she was going to ask something like this. So I've been thinking about it for two whole minutes. And I thought, since we're talking about children, I'll answer, I guess, in two ways. One with some wisdom out of the mouths of babes. I've got a son who's 12 years old in 6th grade, and I'll leave aside for a moment the improbability of my having a 12-year-old. But his teacher, Mr. Horowitz, asked me right before the end of 6th grade if I would come in and talk to the class about our anti-hunger work at Share Our Strength. And I said yes before I checked with my son, not realizing that this would make it the most embarrassing day of his entire life. I knew this because when he woke up in the morning, he came out, and before he even rubbed the sleep out of his eyes, he said, "Tell me you're not wearing that shirt." I was like, it's a blue shirt. He said, "Well, Dad, do me a favor." He said, "Just promise me one thing. Before you walk into class, you'll take your fingers and you'll rub down your eyebrows. Sometimes they go every which way." It's like, great. And then he said, there's just one last thing. He said, "Please listen really, really careful when my classmates say something." He said, "I don't know if it's because you're an older parent, but I've observed that sometimes when I say thank you, you say I love you too." So I was like, okay. I said, "Are there any substantive advice for me, Nate, to connect with your classmates?" And he said, "No, because I thought this was a terrible idea." But the reason I tell you this is that the class itself was pretty interesting for me, because one of the young boys in the back of the class, about 20 minutes in, raised his hand and he said, "Mr. Shore," he said, "I'm curious." He said, "Have you found a way to serve families and children that doesn't embarrass them?" Which I thought was amazing. And another young man asked, "Do you at Share Our Strength get to know and see the children that you serve, and do they feel seen or do they feel invisible to you?" Now, adults, with all due respect, never ask such questions. Only 6th graders or below would ask them. I mean, they're really profound questions that these kids are trying to figure out. I think, in some sense, exactly what you were asking about, Jane, which is how do we treat people equitably? How do we figure out for those who need something that we of privilege might have? How do we do it in a way that is not almost as damaging as the service itself? And I think what we've seen at Share Our Strength is that there are a couple ways, and Dr. Redliner will know more about this than I am, but when you talk about what equity or equality would look like, start with literally just the brain size of children. I mean, as so many people in this room know, there's been a lot of research lately that shows that kids from, the research I'm most familiar with is from Columbia University, kids and families with income below $25,000 have, less brain surface volume than kids in families $125,000 in income above. So if you start there, that tells you almost everything you know. But then if you look at, go into any school. I was last week at PS 75 in New York City. It's at 93rd and West End Avenue, pretty nice neighborhood. 67% of the kids live below the poverty line. The school used to have only 7% of the kids were getting school breakfast. They moved to breakfast in the classroom, which is one of our strategies we'll talk about later. Now it's about 98%. But the last thing I'll say about it is when I asked the teacher, I said, your class looks pretty manageable. There's only about 15 kids by my count. And she said, well, there's 8 that are late. They come from a homeless shelter in Queens. She said they have to take 2 buses to get here. If they miss the bus, and she said they all miss the bus every day. Yeah. If they miss the bus, then they have to take 2 trains. So, just an example of, to me, what equality would look like, what equity would look like would, obviously be every kid having the same experience.
I think it's that same Columbia study, correct me if I'm wrong, that showed that even with small increases in earnings,
yes,
in a family's earnings, in the first 2 years of a child's life, you see a difference in that child's capabilities.
Yeah, and with small supports that could alleviate it, you could see a big difference as well.
And now we know how you interact with your 12-year-old. So I'm going to take you to an earlier time, because one of the things we've been learning here is the importance of the interaction between the parent or caregiver and the child very early on in life, right? And I think it's Jim Heckman has written an awful lot about this. Do we equip parents with the knowledge they need in order to stimulate their kids at an early time? And I'm thinking of parents that are holding 3 jobs, right? Yep. I mean, it's not like they have a whole lot of time to be reading The Wind and the Willows to their kids. Are we supporting families enough? And Erwin, you can grab this too if you want.
Well, I'll just say quickly, then turn it over to Erwin. The hardest part of our work is everybody wants to focus on the child. Nobody wants to focus on the parents. Not a surprise for anybody who's been involved in nonprofits or philanthropy. But of course, the best way that we could help a lot of children is to help their parents and families.
Yeah.
Right. There's no question about that. And the issue of poverty, income issues are principal and the underlying most important cause of disparities in outcome. But the question is, when you say, should we be doing more to help families? Who's we? Is a question we haven't quite resolved. I mean, it's not the federal government probably, and it's not. Is it government at all? Is it the community at some point? Is it other family members? But I think that's one of the really tough questions that we do have to work out, because the answer is, of course, we should be doing something to assist families, and I think we see routinely and everywhere in every underserved community and disadvantaged community, the consequences of families who desperately would like to know more, but who don't. So what's the mechanism for enhancing the ability of parents to parent in a positive way? And one point about this, our experience is that there's a tremendous willingness to get the information and use it. We deal with very, very indigent homeless families in New York City for the past 30 years. I don't think we've ever met a homeless mom or dad with children that wasn't relishing getting information about why it's important to read to your children. I think we understate the willingness of parents to be good parents. They need the information, but we need to have, at scale, that's appropriate to the numbers that we're seeing, the ability and the methodology and the tools to upgrade parents' ability to be great parents.
Mm-hmm. And Mark, I've been finding during this debate on repeal and replace, is that often at the core of the debate is not whether or not we care about kids, not whether or not we think this is a great investment. It's much more about what is the proper role of government, sort of whose responsibility is it? I'm not going to pick on the fact that you come from a family that did extraordinary things in providing for great social programs for kids. But you yourself
just did pick on them, right?
Yeah, yes, I pick on. So
In a good way.
Yeah.
in a good way, in a nice way.
Yes.
Mark. So, but you know, I didn't want to sort of. I want to be talking to you, not your legacy. And what you've done is focused on policy, and not only federal policy, which I think is an important thing for us to to think about. We don't tend to think about the role of governors, of state legislators, of which you used to be one. So as you do your work in focusing on policies that put kids first, where do you target your work right now?
So I'll give you a little background. As you mentioned, I was in the state legislature, and before I was there, I ran a program that works with juvenile delinquent kids, and then also worked in the for-profit sector, running a division of a long-distance company. And I only tell you that just to shed a little light on how I think we try to sell the concept of investing in kids in this country. And I think to the question you asked, Billy, Save the Children, where I worked for 14 years, running our programs in rural America. And what's going on in rural America and the needs in rural America, right, are different than what's going on in Harlem or New York City or in the big urban areas. Most of the poor counties in this country are in rural America. Almost a quarter of them are in the Black Belt of Mississippi. Yeah, so you have these huge concentrations of poverty, and the kids that we're dealing with through Save the Children, there is no public transportation. So there's no subway, there's no train. The bus rides are an hour and a half. If you run after school programs, which we do, and in the summertime, the issue of transportation, how do you get kids there? Because the parents don't have cars, they can't afford the gas to take kids there and borrow somebody else's car. So those issues are all different. So I think the question of how does it look varies from LA to New York, from the East Coast to the West Coast. It also varies from rural America to urban areas. And I know that folks got to figure out where your niche is and where you want to play in that, and go from there. So Save the Children, we started this 501c4 about 4.5 years ago, which is an entity that can be engaged in political work. Most of the work it does is grassroots mobilization, education, a lot of work that is C3 allowable, that is tax deductible, but it then has this extra tool, if you will, that allows us to play in political campaigns. So our big idea or our big goal is to be the NRA for kids. So, if you think about it, what's the NRA for kids? So I would say, to anybody here, do you give money to your state leaders, your federal officials, based on how they vote on kids? So who does? Okay, we got like 4 hands. So, this is kind of the choir, right, Erwin? And if we only have 4 people in here that give money to politicians, of which I was one, we got a family of them, the question is, politicians generally, this is a big generalization, respond to votes and they respond to money. Some of them respond to the science, some of them respond to the ROI argument, some of them respond to social justice argument, but they do respond to how you are going to invest in their campaigns and whether you can deliver votes. And I think if only 4 of us in this room of very influential people are going to give based on how they do on, politicians do on investing in kids, that's a big question we got to ponder. So we looked at it and we thought, we could play in the federal level with a small amount of money and have some influence. We're bipartisan, working with Republicans and Democrats on the issue of early childhood education, that 0 to 8 window. But we wanted to focus on the state level because we think we could make a difference in state Senate races or state rep races and in governor's races, and that real change can happen on the governor's race. So I'll give you one quick example. We played in the Manchester Board of Education, Manchester, New Hampshire Board of Education election. And after it was over, the mayor, who we did not get involved in his race, went up about 3 months afterwards, and we defeated a couple of people that were allies with the mayor. I went into the meeting with a woman who had worked in early childhood education policy for 20 years, and we went in there and the mayor was like this, and he had his arms across, and it was a little frosty meeting. He's technically, he doesn't run as a Republican or a Democrat, he's a Republican because he had been a Republican state senator. And 10 minutes in the conversation, he goes, all this early ed stuff is just a bunch of BS. I said, well, Mr. Mayor, we've seen the studies. Kids that are living in poverty at the age of 4 are 18 months behind developmentally. Wow, 18 months behind developmentally, behind your kids, your nieces and nephews, my kids. And then we spend billions of dollars, Mr. Mayor, trying to remediate that. And he goes, yeah, but all these early ed programs are snacks, they're watching TV, it's a bunch of BS. And I said, well, that's not high quality, sir, and that's what the people in Manchester want you to make it high quality and invest more money in it. And then about 3 minutes later, he goes, and I tell you what, I don't like the fact that you're involved in our political races here. And I said, well, Mr. Mayor, the people running this are all from Manchester, and we're helping them. We're supplementing their work, but this is being driven by Manchester people. And he goes, that's all still a bunch of BS. And we walked out of that meeting. It was over right after that. And the woman
He demonstrated a remarkable vocabulary.
Yeah. I walked out, and he's got a little notepad, right? And it's got a big picture of him, and I put it right on my wall. I look at him every day. And I walked out of the meeting, and the woman I was with said, that was the worst meeting I've ever been in. And I said, are you kidding me? That is the best meeting I've ever been in. We pissed him off because he didn't want to give money to poor kids in Manchester to have high-quality early education and health services. We're alive. And we're advocating and working on behalf of poor people to put pressure on this guy. He ran for governor. We didn't endorse him. He lost. He's still mad at us. We were endorsed in both the Republican and the Democratic primaries. The Republican lost. It was going to be tough. We ended up supporting the Democrat in the general election, who lost to Governor Sununu, Chris Sununu, who's now governor. And Governor Sununu took our piece of legislation, which is all-day kindergarten. He picked up the idea after we spent $1 million trying to beat him, and he drove it with our help. I wrote an op-ed in the Manchester Union Leader, which is a big Republican newspaper, congratulating him on his initiative on early ed, all-day kindergarten. And the bill passed yesterday, and I got a text this morning, Erwin, from Chris Sununu thanking us for our work.
Fantastic.
And I was in the legislature. Yeah, it's great, right? It's crazy.
Fantastic.
I was in the legislature for 8 years. I never. Thank you. I never got a note from the Democratic governor in my own party. Never talked to me for 8 years. And Governor Sununu said, you guys were instrumental in making it happen. So it's a long answer to your question. We thought that if we started there, we did grassroots mobilization, we did communication smartly, we then raised money and got engaged in the political campaign, that we could make a difference in a state that is as libertarian and conservative leaning as New Hampshire. It went through a lot of twists and turns, and it passed, and it's about $17 million new dollars every year on all-day kindergarten. And he's going to get a text from me in about an hour, Governor Sununu, saying, we're going to start, your people in New Hampshire now want home visiting, because that's the next big issue. But you can make a big, profound difference. And then we're going to use that argument with Senator Hassan and the other members of the state legislature and the federal legislators, and try to impress upon them the importance of this. But I think the NRA for kids, I hope if you don't remember anything else I said, that's the image we need.
So this is a 2-second intervention, Erwin.
Well, I just wanted to, actually, can I just show,
Yeah,
Mark,
sure.
over there, could you show that fourth slide, the last slide? In my group there is on the second set, but,
Return to you.
yeah, so right there, the one before.
About states.
Okay. So could you put it back to the beginning of that? Okay. So a couple of points. I wanted to make this point right now because Mark brought I was going to talk about this later. But for philanthropists, there's a few messages here that inherent in what Mark was just talking about. The first thing is that many of you do direct services. You support children's programs. You're big-time supporters of children's hospitals, and all that is absolutely critical. And it's not in conflict with the other piece of this is that we also need advocacy. We need your voices, your commitment. We heard some of this last night from David and others who were speaking to you. But both are needed, and they're not in conflict, but we definitely need part two. The second thing is, this is absolutely critical to understand. Politics essentially always beats science, data, and logic. I'm sorry, that's the history, that's the reality of it. I don't care how much data, how much information. As Mark said last night, he spent 2 years getting himself organized. He went and presented all the data to legislators, and nothing happened, right? So this is why it doesn't happen, is because politics, and good politics, always prevails. This is why, by the way, the NRA has been so successful. In spite of the data about the downside of what they're promoting, they win because their politics are spectacular and they're highly funded. I want you to remember that because that is going to be the key to what we need. The third point is that social change in the big picture is certainly desirable, but it's slow and uncertain, and as many people have talked about today, kids cannot wait. And they want to know, children, I'm telling you, I speak to them, I whisper to them, they want to know, where is our well-funded media campaign and my Take No Prisoners PAC? And Mark Shriver is probably, I can't think of anybody else in the country who's been more effectiveness, but we need about 50 times more assets for Mark and others to do the work that he's doing, and we will prevail. Where are those assets coming from? They're not coming from piggy banks. They're coming from people who care about whether the work that we know about and the impact that our work should be having on policymaking. We need to be able to take that and translate that not into policy, but into politics. And then it'll become policy.
Thank
But
you for your 2-second intervention.
That's my 2-second event. Thank you.
And Billy, I'm going to let you respond, but I also just want to say is there are terrific government programs in place that aren't being used as much as they could. So I do want you to speak to that as well.
Yes, well, I think I can maybe tie the 2 points together with that question, and I think illustrate the opportunity that exists here. Because what Mark's talking about is true not just of the elected officials that are on the wrong side of these issues, but there's also a big opportunity on the elected officials that you and I would think are on the right side of these issues. And I'll give you one example. About 7 or 8 years ago, we got very focused on the fact that there are 21 million kids in the country who are eligible for a free or reduced price lunch under the federal school meals program. 21 million. But only 9, and all 21 million are eligible for breakfast, but only 9 million of the 21 million were getting the breakfast. All 21 million are eligible for summer meals when the schools are closed. Less than 3 million of the 21 million are getting it. Bought and paid for all 21 million. So big opportunity there if people understand it. And one of the things I remember meeting actually that Erwin and Mark, I think, and I were all at with Marian Wright Edelman, where Marian was talking about, and who's kind of like, the matriarch of a lot of these issues, she was talking about, some of these battles we don't need to refight, we've already won them. We just need to make sure that they, kind of get executed. And so I came to Colorado, the first governor that I actually spoke to about this was Governor Hickenlooper's predecessor here, Governor Ritter, who was a Peace Corps volunteer working on actually food and nutrition issues in Zambia, really good guy, kind of a centrist, moderate Democrat, really cared about hunger. And I went into his office and I talked about at the time, Colorado ranked 47th lowest out of the 50 states in the percentage of kids who were eligible for these programs but actually participating. So enormous gap. And he was very surprised by that. And he said, what's it mean? And we talked about some of these issues in terms of the consequences that it has for kids. But I said, it also means that you've left $150 million in Washington on the table, $150 million that only could be used to buy milk from Colorado dairy farms, bread from Colorado bakers, supplies from Colorado vendors. And he turned to a staff person and he said, is that true? And she did a kind of a, yes, I'm afraid that is, sir. And he said, well, why do we need the guy in the blue blazer from Washington to tell us this? How could this be? And I say it as an example of for a really good governor who subsequently did everything he could to reverse this. And today, Colorado ranks 11th, not 47th. But even for a really good governor, these kids are not only vulnerable, but they are voiceless. They don't have PACs except for Mark's. They don't vote, obviously. They don't have lobbyists except for when a handful of us are able to do it. But such an enormous opportunity, because everything else that most of us work on, we're fighting for new programs, new funding, and so forth. And I don't mean to suggest that this school meals thing is kind of a panacea, but there are places, there are other areas of opportunity where funds have been appropriated, and even the most enlightened public officials, it's just not on their radar screen because, I think, Erwin, because the political argument hasn't been made. I mean, when we were talking about 150 million, we were talking about politics, essentially.
Yep.
I think that's really important that if, there's a table of people here from Colorado, right? If they show up, when I was a state rep in Maryland, and 10 people show up, 10 of you show up in my office, even 5, and you follow up after you give me that information and you follow up once or twice, I'm going to respond to that because each state rep is elected, by a couple of thousand votes because they're small numbers. And they can have, what is it, 150 million bucks?
So, yeah, just in Colorado. Right?
Wow. I mean, that's
relatively
a big
small
deal,
state.
and it helps me get reelected if I figure out and can take credit for that. I'm just being honest with you, right? And that will make a profound difference. But it's literally 5 or 6 people.
And the result of doing this, by the way, in state after state after state, because we've now done it with about 20 governors, is 3 million kids added to the school breakfast program. Deloitte looking at the schools where the 3 million were added and telling us math scores are 17% higher, attendance rates are several days longer. So when you follow the thread to what we really care about and the reason we're really doing it, the consequences can be profound.
So Billy, let me zero in on your strategy, on share our strength strategy, because here's something where you take a discrete problem, the problem of hunger, and you have a clear goal, and that's to ensure that all kids in this country have access to nutritious food. And then you take a multi-pronged approach to it, to your strategy. Yes. One piece of it is connecting parents to government programs. Tell us about the others.
Well, and I should say that we even got more discreet because we worked on a whole lot of hunger issues, and we started to say to ourselves something that the writer Jonathan Kozol talks about all the time, which is pick battles that are big enough to matter but small enough to win. And so we asked ourselves in our space, what would that construct look like? And we realized it was children in the United States who were hungry on a chronic basis. So, and
we're talking about what, 30 million? How many kids?
We're talking about probably about 22 million kids, and it's mostly the kids who live below the poverty line. Yeah. And so we really focused on this school meals opportunity and the summer meals opportunity. There's an after-school program as well. Programs that are so small in the scheme of things that they've actually been exempt from the sequestration automatic budget cuts. They have a track record of bipartisan support. We've worked with as many Republican governors as we have Democratic governors, since there's twice as many Republican governors today as there are Democratic governors. So that was important. And we focused on that, but we also focused on, to circle back to where we started the conversation about parents, making sure parents have the skills, whether it's nutrition education or grocery shopping skills or food budgeting skills, working with them. I think to Erwin's point, most moms and dads want to do the right thing if they have an opportunity to learn how to do it. And so we've done a very extensive suite of services to train moms and dads how to do that. Something, frankly, as simple as if somebody teaches you how to carve up a chicken, then you buy a chicken whole rather than buying chicken parts. And if you're on a SNAP food stamps, you're going to save a couple bucks doing that. And then partnerships with the corporate sector as well. Our whole thing has been to kind of not to preach to the choir, but to make the choir grow, to try to find ways in which we can create these win-win relationships with companies, mostly in the food space, the culinary industry, restaurant and food service industry, related industries like Williams-Sonoma, that would have a connection to the issue of feeding people since they make their livelihoods from it.
And the public-private partnership, right, Billy, is a big piece of what you do.
And it's a big piece. It's the key piece of our revenue. We have a budget this year of about $64 million, and probably 2/3 of it is related to cause-related marketing, which means we don't compete with brother and sister organizations for finite philanthropic resources, although we're glad to accept them. We don't have strings attached to the dollars as long as we deliver marketing value back to the partners.
Yeah. I'd like to just stay on cause-related marketing for a moment, because I think those in the nonprofit sector, including me, tend to look with sort of askance at strategic communications. And if you think about the most effective foundations in this country, as well as nonprofits in this country, really do invest in strategic communications. It is part of persuasion and legitimate. So tell me how large, how big is that within your set of activities?
It's very important for us for a couple reasons. One is that and from the very beginning, we thought, as important as philanthropy and charity is, and there's so much that it can do that government can't do, so it's vital, but it's at the end of the day, it's a finite pool of resources and not enough to solve the problem. So our belief was we had to not fight for our share of the charitable pie, but we had to make it grow. Okay. So we had to be an organization that didn't redistribute wealth, but actually created wealth that we call community wealth, because it goes back into the community. And if you think about it, our organization doesn't compete against Mark's organization or Erwin's organization. We're competing against Nike and Disney and Amazon and anywhere anybody is spending mind share or money that could be going to what we do. And so we decided that we had to tap into those market forces. So, a kind of a typical example for us is if you know Shake Shack, Danny Meyer's casual hamburger chain, in the month of May at every Shake Shack, every cash register, every server will ask you, do you want to donate $2, to share our Strengths No Kid Hungry campaign in exchange for a free $5 milkshake the next time you come back. You don't come back alone, you come back with somebody else, you buy more than a milkshake, they get the return business. They don't give us any money, they give us their customers money. So it's kind of a win-win partnership in that sense, and those are what we try to create. And I should tell you, and the best part of it for me is that standing in line, because there are lines at Shake Shack, and watching these servers sell our $2 coupons as effectively as they did. I went up and introduced myself to one to say, you know, just I'm blown away. You're as good, if not better, than some of our staff in describing what we do. And she said, oh, well, I used to be one of those kids. Totally get it. That's why, because that's why I love to work here. So it's, for us, it's not just about money. It's about that opportunity for customers who may never walk into Share a Strength, but will walk into Shake Shack or Williams-Sonoma or TGI Fridays to hear a little bit about what we do, and to engage employees who realize that they've got a strength to share. There's a way they can make a difference. What they always say is, I never realized I could make a difference just by working at Shake Shack. So empowering in that sense.
And meanwhile, that money then goes back into the community. You're reinvesting.
All that money goes to the school breakfast programs and
Right,
other
right.
anti-hunger work. Yeah.
So Erwin, you've taken these discrete problems are huge, so just bear with me, but yours is to ensure consistent access to healthcare and a kind of an integrated form of healthcare. So I want to hear about that and hear about the whole concept of a medical home.
Yeah, so I think the topic of this panel is going to be is the social determinants of health, which is a critical concept, obviously, that and it actually applies to one-on-one doctor-patient experiences. So I'm looking at a patient. That patient is living in poverty. Patients had very inconsistent access to health care, and so you're making a diagnosis, and then you're trying to treat the symptoms that occur from the social disparities. And that's a problem. But Mark, can we put up that first slide? So, but I want to just put this concept of medical care in a little bit broader context. So, I think I stopped talking really about healthcare. Yeah, we do healthcare. We do 300,000 encounters a year. We've done 4 million health encounters with kids and parents since we started the program 30 years ago. But I'm really now talking about success of children. And for that, we're talking about where does health fit in, because it's only one of several different concepts there. So if we're looking at the success of a child, you might think about this like a NASCAR race. I think healthcare providers are in the pit stop, but so are teachers, parents, social workers, people who deal with food programs and so on. But we're one of a group of people that I hope are dedicated to the kids getting across the finish line, which is the point here. So we have a program called Healthy and Ready to Learn, for example, that Karen Redlener started a few years ago, which is basically saying we actually need to integrate the delivery of services much more tightly than we have been. So we've been looking now at 7 specific health conditions, not just a slogan, but specific evidence-based health conditions, which we know from the literature will actually interfere with learning. And we want people dealing with poor children, poor families, to focus on those, make sure they've been screened for, make sure they're being managed, and we'll have a big impact. But we're fertilizing the health agenda with the education agenda.
And those 7 are?
The 7 are hearing problems, visual problems, chronic untreated persistent asthma, lead exposure, certain kinds of behavioral problems, hunger, persistent and recurrent hunger, and was that 7? Was that 6? Did I say asthma? Oh, dental pain. Not just dental going to the dentist, but kids sitting in classrooms with uncontrolled dental pain. So that's the 7. And on our website, there's a lot more detail about this. But whatever we do, we don't want to just give a slogan to healthcare providers. We want to say, whatever you do, don't fail to screen for and manage these things, because they can interfere with classroom performance. The second point is that the social determinants of health clearly are important, but there are many other determinative factors that affect children and their ability to function and become successful. And there's many of these that are not really in the traditional way that we look at social determinants. And some of those have to do with developmental delays or toxic stressors that we see in childhood. There are many factors here that may be involved. But we think that every child needs what's called now a medical home. And I just want to make sure that I've explained this a little bit to people. So first of all, the medical home is what I would consider to be the gold standard for healthcare for all children. And it's essential for children that are living in poverty. And here's what we're talking about. When we say access to health care, we don't mean access to a primary care clinic or access to just a hospital. We're talking about access to the entire system of care, from the primary care to the specialists, to community services, to mental health, to food services, and to the hospitals. And all this has to be somehow coordinated. So the primary care provider becomes a quarterback for making sure that children get whatever they need and that we're available. This concept of the medical home encompasses the biomedical issues that we learned about in medical school, but it also encompasses all of the social determinants, school readiness issues, the adversities, the adverse childhood experiences, or ACEs, toxic stressors, et cetera. So we've expanded the functionality, ideally, of the primary care provider, who is the coordinator of the medical home. Very important. And the message of having a medical home to providers is, we want you to commit to fully comprehensive care that you will help manage and make sure is available to children across the board. And the message to kids and families is simply, we're there for you. We're there for you. This was true when I was running a clinic in East Arkansas in the early 1970s. It's true today with our homeless populations in New York City and other spots around the country. That message is critically important. It's one of the ways we get families to accept our messages, to be willing to take in the information and the tools to improve their own parenting and participate in the improvement of health status and working on the success of their children. So the medical home, just remember this concept when you're supporting the things that you support, even if you're at a children's hospital, I know many of you are, that I see you as part of a system, and the system has to be intact and functioning for children to get the maximum benefit.
When you think about it, those with greater privilege have a concierge service, right?
That's right.
And this is a very similar idea, where you sort of you have one physician coordinating everything. But does this go beyond? Does this go beyond to communicating with schools as well, or is it this stay within the health system?
Yes, yes. Okay. So if we see children and we're screening them for these health barriers to learning that I referred to before, we want to make sure that not only the schools are aware of these issues and they're going to be managed, but the schools themselves are aware. So a teacher looking at a classroom and looking at a number of children in poverty who are not doing well, what's the absentee rate for that particular child? Right. Is there a medical or social, psychological, behavioral issue behind that? Is this child in hunger? Is the child hungry every day? So awareness in the schools of health barriers to learning, and awareness in the providers of the things that affect schools. And this implies a very close relationship between educators and healthcare providers, which is the goal.
And Billy, you work schools in as an early, or teachers in as an early warning system. Say something about that.
Yeah, well, teachers are, they're obviously in the best position to really bear witness to what's going on in their classroom. So we've got a survey coming out, I think on August 3rd. 74% of public school teachers say hunger is a serious issue for a number of their students. 54% of public school teachers spend their own teacher salary every month, up to about $300 a year, to provide food for kids in school. We've got a relationship with the author John Grisham, who just made a very generous donation to us, and I went down to Charlottesville and had lunch with him, and he was telling me that the reason he was so passionate about this is he's from Mississippi, where he said, I've always understood there to be a lot of hunger. But his daughter, his 23-year-old daughter, is a public school teacher in North Carolina. And he said her teacher salary is $32,000 a year. And he said, my wife Renee and I spend an equal amount just providing food and supplies for her classroom. So I mean, it's just remarkable when you think about what teacher salaries are. The teachers are spending their own money to do this. But yeah, they're a very important witness in terms of what we do.
In the working group on social determinants, one of the speakers put it out that a big issue is that caregivers, as well as teachers, are underpaid. Right? And so we have a real problem of a pipeline of talent, because if you're coming out of college with student debt, you can't afford to take a job like that. Mark?
And I would just say the ones that are particularly in the early childhood system, if you will, if they are talented, they get promoted and they go up to the K-12 system and they're making more money. So it's a big issue. I mean, I guess, to me, if I'm sitting here and I see, Erwin, your presentation there, and it's what we grapple with. How are you going to make that happen? And the layout of the medical home, and we do the home visiting piece.
Yeah.
We're teaching the parents by hiring local folks that are paraprofessionals. We train them like relentlessly. They're in the homes teaching the parents how to put the round thing in the round hole, and because that's developing the fine motor skill of the kids. They're reading to the kids. If they don't know how to read very well, they're doing nursery rhymes, which is stimulating the social, emotional, and cognitive development of the kid. We're doing all that, but we're struggling for funding for the programs that we work in, and we're working in a lot of really poor states. So then the question to me is, the model you laid out there, which we work with you on, is how do you move that from a great idea, and what are these people going to do here
And how do you
when they
scale
walk
it?
out?
Right. So here's where philanthropists can have an important, not just the money, but the voice of major people of power and influence in America can help create what would in essence be a moonshot project that the United States needs to commit to making sure that every child in America, especially poor children, have a chance to become successful. And I think the data is just overwhelming that this is absolutely necessary for the country's future. And even the data that we heard yesterday from Dell Myers about the demography, which is an inevitable outcomes for children that are being neglected, is a disaster for the country. So somehow having national leadership stimulated by people of influence is the only way we're going to accomplish this. Otherwise, we're going to be doomed forever to really great demonstration projects, new research, et cetera, without really moving the needle that Mark wants to move.
Right. Usually what philanthropy will do is pay for that demonstration project, right? And to demonstrate the efficacy of an approach with the idea that the public sector can then scale it, right? And it seems, isn't this a big part of what you're doing, is demonstrating what works?
Yeah, well, I've been doing this since 1971.
Yeah. So you're still waiting for it to be scaled?
I am as addicted to demonstration projects and pilot projects as anyone else, but I'm sick of it. It's just like we do not need one more iota of data. We don't actually need another piece of and we need research because we really want to get into what's needed
Scientifically.
and figure out what we know. But to change the world of what's available to children and their opportunities, we need no more research, period. We need advocacy, we need politics, we need Mark Shrivers and Billy and many others like them to kind of take what we already know and say, what the hell's going on here? We can't tolerate this, and the future is going to be far worse than the present. So
And if I could
that's
add,
what we have to put.
If I could add, I mean, I don't think it's the Billy Shore in Washington or Mark Shriver in Washington. I think it's you all.
At home,
Because, what?
back in the communities.
Yeah, because the big shots when you're in state government aren't from Washington, D.C. They're from, if you're from Washington State, it's, you're from Seattle.
Right.
You're from Mercer Island. You go in there and you're a business person and you're talking about a medical home and demanding that your state reps invest in that, and you're going to either help them out. Obviously my thing is to help them out financially during campaigns. When I was in state legislature, I worked on after-school funding, and there's a big ad in the newspaper, thank Delegate Shriver for his leadership. I got no phone calls. So I knew that behind me it was like a paper tiger. But if you're running a children's hospital, you have a board of directors, you've got all the big shots in Washington State or in
For the
Colorado.
first time in 20 years, I'm going to disagree with Mark Shriver.
About what?
Thank you for
About
saving
this
this
point.
for us.
Yeah. So here's the thing. I don't think there's enough money in the states to take care of this entire problem. The poverty rate in 1971 was more or less what it is, maybe even a little bit worse.
I'm not
now.
saying it's an either or. I'm
Okay,
saying
that's fair
it's
enough, yeah.
both, but I'm saying you can have a big impact, and all politics, as you know, is local. So when we spend
Is it?
Well, I mean, we spend $1 million in New Hampshire. Maggie Hassan, when she's running for U.S. Senate, is calling me up and thanking me. So she knows we're spending the money out there. She knows that stuff's happening. She's reading the letters to the editor that are in the Concord paper. She knows that when the sheriff from Concord, New Hampshire, is writing a letter to an op-ed talking about that he's locking people up that he knows are reading on the 3rd grade level and that have ADHD.
I would add one other dynamic to this, which goes to the value of the state work, which is in Washington, where I've been for a long time now. Everybody knows that Washington's a mess and gridlocked and things don't get done. The dynamic is, for at least the last 15 years, is so profound that whatever one party proposes, the other party automatically opposes. And literally, if I go to talk to any member Congress or any staff person, they've got to check with Mitch McConnell or Nancy Pelosi or Chuck Schumer to see if they can support what we're doing. It's all about who's going to have the majority and the speakership, and who's going to, are we going to preserve it or are we going to attain it? At the state level, governors don't have that issue, right? There's not a balance of power issue. So a Governor Sandoval in Nevada, Republican, can say, yeah, we've left all this money on the table. We want to go get it. We've left all these kids out. We want to fix that. And they could just make it happen, and there's nobody they have to check with. So it's just another, to me, data point about how much opportunity there is at the state level, because it gets you out of all that, really, disturbing dynamic in Washington, the cynical dynamic in Washington.
So I don't want to downplay the role of knowledge. I mean, I understand, Erwin, your point, and Mark, your point. But it is powerful to know that if you get those first 5 years, or 0 to 5, wrong, you can have children without the social and emotional skills to go to college, to get a job, to thrive, to be upwardly mobile. You also can have a situation where obesity, high blood pressure, you go down the list, diabetes, are so likely. And understanding that, I realize that's not the only motivator, but understanding that we're not just talking about something nice to have, but something an advanced society must have. I don't want to let that go. I do want to, though, make time for questions. You all didn't get a chance to jam into the working group that I had the pleasure of being in on social emotional determinants. And so I wanted to see if you wanted to ask questions of these three, or else I'll keep asking them. Any hands?
Right there.
I think a mic is almost there.
Okay, thank
Yeah.
So back to the supporting your representatives. Do you find a representative who is supportive of your causes, or do you go to him and say, these are my causes, can you do that for me?
Well, I think it depends. It depends on whether the person, state senator, X, has shown leadership in the issue of early childhood education, and I use that term broadly because Erwin beautifully explained what that encompasses. And obviously, we're working very closely with people that are in the town, in the state beforehand. I use the example of Manchester. So the advocates in Manchester and on the statewide level were pushing all-day kindergarten. So we didn't come in from Washington and say, hey, we want you to do all-day kindergarten. And there were a couple of folks, a bunch of people that were interested in it, but they didn't have, some of the political expertise, some of the resources, some of the convening abilities that we bring to the table, but they're leading the charge. And when, again, I'm repeating myself here, but when you go in with 5 people and say to State Senator Smith, you've been really good on the issue of early childhood education. We are really interested in investing more in home visiting, and you've talked a little bit about it. We want to partner with you and push this. It's not going to happen today or tomorrow, but that starts the conversation, and you hold them accountable, and you raise some money for them. Yeah. It's a combination of things. I mean, this comment with the nice to have versus the necessary we use that language internally at SAVE, the Children Action Network, because everybody thinks the work we're doing is nice. We're doing God's work, right? I call it the bobblehead when I was, going to state governments, and they say, you're doing God's work. You're doing wonderful work, Mr. Shriver. I go, yeah. And then when push comes to shove, they don't give us any money. Like, you're tired of it, I'm tired of it too. I mean, it's like, why are we waiting for the scraps? Why are you all, when you're on the board of Children's Hospital? I mean, businesses aren't doing that. I mean, there's investments from Exxon and from, the Koch brothers, they're putting $400 million into state races. That's who, I mean, I'm not a supporter of the NRA, but I admire what they do. And that conversation you got to have is respect what they do. You got to have those conversations, and it's hard because people don't like politics. It's dirty. That first slide you showed, Erwin?
Yeah.
People don't like that, and your body language in here, right, was a little, ooh, right? I mean, right? Does anybody disagree with me? I don't want to do politics. It's nasty. I like to be liked. You got to get in the arena, the old Teddy Roosevelt arena, and get bloodied and beaten up.
Yes.
The guy may tell you to go take a flying leap. And
Well,
then,
what I would like to tell the bobblehead person, I say, Mr. Bobblehead, we're going to primary you. We're going to put $500,000 into an opponent.
yeah, but you
that's
got
gonna run.
to follow up.
I understand, but it's not $1.50 here. We're talking about a significant PAC for children that's got tens of millions of dollars in it. So you could be, that's a serious threat. That's not just, oh, we're not going to like you, we may get people to not vote for you. We're going to primary you, and you're going to lose. And we're going to put $1.5 million into the campaign against you, and we're going to support a candidate who's going to run against you because we don't like your bobbling your head when we're talking about the needs of children.
So now we've learned that if you put a pediatrician on stage, when he says primary, he's not talking about care.
Primary.
So this has been
Oh, no, I didn't mean
news.
primary. I'm not giving you immunizations. We're talking about
This is news to me. But let me just sort of say to broaden this, because
Yeah.
there's one. I mean, obviously the government's where the money is. I mean, there's a good reason to want to make sure we get our policies and programs right. But there are other parts of society that are contributing or not contributing to a culture of health for kids. I know I sit on a board where, after being on the board for about 8 months, I said, well, by the way, love to see what you're doing for daycare for your employees, and went through these things. It was astonished to find out that this board, who had a very good reputation, was doing nothing in that area. And the question produced change. So there's an opportunity, if you're on a nonprofit board or a corporate board, to advocate within as well.
That's a great point.
And it helps you get more partners.
Yes.
work with you.
I think also, if I was going to be self-critical of our community, I'd say one place where we could do a better job, and I think it relates to this conversation, is reframing the narrative so that people understand the broader consequences, that it's not just about poor kids. If enough people cared about poor kids, we wouldn't all be here. They don't, but people do care about a lot of other things, which is the economy and our economic competitiveness and our healthcare costs and our educational achievement. And somehow we've got to find a way to make sure people understand that when 50% of kids in a public school classroom are hungry, the other 50% are being held back as well, because the teacher is trying to teach all of them. I'm not a communications expert, I don't know how we do that, but I know that some of our resources have to get into reframing this narrative so that people see the much broader issue of, how can we have a strong America if we don't have strong kids?
And I think that's a great point, Billy, right? Because the messaging, going back to the question, it may vary from person to person. So, I was over in West Virginia a couple of weeks ago, or about a month and a half ago, and 50% of the kids are in Child Protective Services because the parents are all impacted by the opiate epidemic, and they're in jail or in rehab. So, it's how do you frame that?
Yeah.
And for maybe a conservative state rep, it's about the ROI. It's about, if we get with these kids and the families earlier, it's going to save the money later. Maybe someone who's more on the, let's say, left side, the message is around a social justice thing. We talk about Jim Heckman, Nobel Prize winning economist from the University of Chicago. That resonates with some people.
He talks ROI. Yeah,
He talks
absolutely.
ROI, and some people are like, I'm not interested in that. So
Yeah.
really we have to tailor your message when you go in to talk to that person. And again, unusual characters to come into the room and have those conversations, whether it's a nonprofit leader or a for-profit business leader from your community, is a really powerful person.
Well, here's a really interesting reframing. The big objection that we've faced to moving breakfast from the cafeteria to the first period, which is our strategy for vastly increasing the participation, the big objection, actually everybody you could possibly think of objects to the idea. The teachers union says we don't clean up spilled milk. It's in our contract. And if you go into a first grade classroom, you realize that they don't, like some of them don't spill their milk once a week. They all spill their milk every single day because they only have little first grade hands. The janitors union says we're not picking up trash at a different time. The PTA says it's going to interfere with instructional time. What we found, and our entire argument now, is less about feeding kids, but we found is that it's actually, Virginia's was a good example for us. We did a conference of all the principals and superintendents. To a person, they said it increased instructional time, to their surprise. Most kids who needed to eat were not getting to school early enough to go to the cafeteria. they were getting to school barely on time, and instead of going to first period, they were going to the cafeteria. So now they've actually increased instructional time by about 20 minutes a day, which in education circles is the coin of the realm. So we're now talking, less about hunger and hungry stomachs than here's a way to increase instructional time in your classroom. So that kind of reframing, I think, reaches a much broader audience.
Yeah, I think it's important to understand that social change happens from the ground up too. And, it starts with the individual and ultimately is in the full society. Yep. And then there was a question over here, so we'll go to you second.
Okay.
Messaging, social networking, IT connections. There is an organization called Every Child Matters that I think you're familiar with.
Yep.
And I guess my question is, can we build on their messaging platform? I've been impressed with a lot of what they do.
So we work very closely with them. They're in the similar space. Again, I think what Billy's talking about, the message that you sell in Seattle is different than the message you sell in Jackson, Mississippi. That's Every Child Matters understands that as well. So I think they're a good partner. But, back to Erwin's statement, they're small. I mean, we're all small, relatively speaking. And I think we need to look at how we partner better and more effectively. Because a lot of philanthropists will say, you ought to partner, and then when push comes to shove, it's harder to partner in the nonprofit arena because we can't offer $20 million in retirement in Naples or Aspen. So there's ego involved in there, and there's not the financial thing, which just makes it slightly more complicated. But we have to figure out better ways to partner here, but also with Every Child Matters, which is Michael Petit's group, which is really good.
We're here. We have a question.
Hi, I'm Alyssa Geddes. I'm a pediatrician and adolescent health specialist at Children's Hospital of Pittsburgh of UPMC. And we foster and adopt and promote the children's home model because we can. As a children's hospital, we refer within ourselves, regardless of the insurance the child has. We have behavioral health specialists. We have other subspecialists. But in reality, when you're not in a children's hospital environment, as a primary care pediatrician, you're given 15 minutes with the child. If you refer, there are specialists that won't take no insurance, Medicaid. So I understand the concept, and I have the luxury of working within a system that promotes that, but it's a limited few who can promote that because that's not the way our healthcare is right now. And then for Mr. Shriver, one of the things, I just went to a conference sponsored by Western Psychiatric Institute and Clinics in Pittsburgh, and you were saying how, we've got these parents, they're addicted to opioids, they're unable to care for their children. A lot of the studies in mental health show that the maternal grandmother is an amazing resource for a lot of these kids, that I know we would love to involve the parents, but there's extended family that has really helped with anxiety, depression, suicidality in the adolescent and young adult population. So even though I know we want our parents to be the first go-to, there are other resources, and specifically the data shows the maternal grandmother is quite important.
Yeah, Erwin, you can answer the first part, but I didn't mean to imply that we weren't working, through Save the Children with, in many cases, it is the grandparents. I mean, you all probably read the J.D. Vance book, Hillbilly Elegy, where the grandmother had a profound impact on his life. And we work in communities that are literally 5 miles from where he used to go in the summer and hang out with his Kentucky relatives. So, we work with whatever support systems there. I was just giving you the example of, wow, 50% of the kids are in Child Protective Services. So the issue of, home visiting, all these different ways, we got to look at it comprehensively. And then since those resources in rural America aren't there, how are we then going to try to affect change on that? And that's the really hard part. When you identify, going back to your first question, what does the community need? It comes from the community, but then how is the community empowered to make a difference. And I do think the change oftentimes comes from the bottom up. I mean, you gotta have the top to help, but most politicians are followers. You either get out too far, and you don't want to get out too far in front of your constituents. So constituents always lead. I mean, look at social changes came from Martin Luther King and, you know, Rosa Parks and Lech Walesa. These are all, you know, high school educated people. Lech Walesa brought down the Soviet Union. Wow. But he's also working with other people that are, you know, from the top that are in the establishment working. Do you want to answer the first part of that?
Yeah, this question is very important about the medical home, and I present it as the gold standard, and we think it is. We provide the medical home in all 25, or attempt to, in all 25 of our programs around the country, even very, very disadvantaged urban and rural communities. But we wouldn't be able to do it at all if we only were dependent on Medicaid dollars. And there's all kinds of issues here about Medicaid reimbursement being completely inadequate to provide even basic services, no less the advanced medical home services that I've been talking about. And we are looking for parity with Medicare reimbursement at the very least. So in our programs, we are exquisitely dependent upon philanthropic contributions to supplement what we're getting from Medicaid in order to do what you're saying, because otherwise it's virtually impossible. So this is a little bit of a, I'm saying here's the gold standard, but we can't do it ubiquitously in the absence of having real support from the private sector, the philanthropic sector, and the public sector as well. That's why I think that we must really deal with all the levels, from the community to the state and local governments, but to the federal government. And this is clearly a moonshot agenda with lots of different aspects to it. But I really admire what Pittsburgh is doing. It's really quite fantastic. And I think there's probably a few other hospital and healthcare systems around the country that are doing that, including in New York at Montefiore and other places that I'm aware of. But I think your point is very well taken, and we do have a tremendous amount of work to do in that.
We're going to have an opportunity tomorrow to hear from some of these programs that have been developed on the community level. What percentage of kids are benefiting from Medicaid right now?
33 million children in America are on Medicaid. There's 75 million total.
So that's 1 out of every.
Yeah, and then there's another 6 or 7 million on the Children's Health Insurance Program.
Yeah.
So we got a good 40 million, more than half. Somebody mentioned this, maybe Mark did last night, but
yeah,
we have a huge number of American children that are dependent on these public resources.
right, which may be cut back now.
Which may be, we're facing a serious challenge to one of the most fundamental promises made in the 60s by Lyndon Johnson, by Sergeant Shriver, and others, that we're going to create real safety net programs for our most vulnerable citizens, particularly children, disabled, the elderly, et cetera. So what is being proposed now about Medicaid, and I recently described this as taking a fiscal sledgehammer to a fundamental promise that America's made to its poor children and wrecking it by, they're calling it per capita caps or block granting. All of these things limit the amount of money that states would actually have to provide for children who otherwise are eligible for the full range of Medicaid services. Very dangerous. So if you have a few minutes and want to write to your member of Congress or write a couple op-eds, please do, on basically leave Medicaid alone. It's too vital and essential, a central promise.
To get to that point, government has been a big theme. Government has been a big theme. How successful have the programs been? Has the problem increased the number of kids in poverty over the last 40 or 50 years or not? Because I think we've heard thematically that private dollars, private investment is a critical part of making changes, but we seem to be talking quite a bit about government's hand in this, and I guess I don't have the knowledge to say whether government's really been effective over the last 40 years.
So I think it'd be useful, I'm going to start with Billy, but there are a set of programs, even Early Head Start and others,
Sure.
not just Medicare, that work. So tell us, Billy, what works?
I would say a lot of government programs have been effective. If you look just again in the small space where I work around hunger and what folks now call food insecurity, it's at its lowest level by far in decades. There's still a significant population to reach, but if you add 3 million kids to school breakfast, if you create 40,000 summer meal sites, SNAP participation is just about where it should be. It's almost fully utilized.
SNAP being what we used to call food stamps.
Food stamps, what we used to call food stamps. You see those numbers start to really go down. So there's still a lot of what I think of as kind of culture war issues around some of these. There's a big issue around SNAP and whether able-bodied adults without dependents should be required to work, which they currently are, but there were waivers for that during the recession. But if you look at the 44 million Americans who are on SNAP today, up from 26 million before the recession, 44 million Americans still on SNAP. Half of them are children, half of the rest are elderly, half of the rest are disabled, severely disabled. So we're talking about, you get to the point where you realize you're talking about a very small population that this battle is about. And to me, it feels more like a culture war battle rather than a real dollars and cents battle about how to use our funds. But for these programs, the number of people who have been lifted out of poverty, and SNAP's just one example, there's lots of others, Medicaid, all these programs, when you put them together, it's tens of millions of people who have been lifted above the poverty line as a result of them. So they can always be improved, but a lot of them, SNAP went through 30 years of being hammered until they wrung out, just about as much fraud, waste, and abuse as you possibly could wring out. And I think that's true of the others as well.
Yeah. Yes, here.
Hi, Katie Beckman, David and Lucille Packard Foundation. I have a question for the panel, but just in terms of your question, I would say that there are a number of programs that work but aren't necessarily fully funded, and that includes Head Start and the Child Care and Development Block Grant. There are many eligible children who can't receive those sources of dollars because of budgetary decisions. And only about 10% of federal spending is spent on children, only 10%. That's pretty dramatic. So anyway, my question is, could you please address the current political climate and how that changes your philosophy in terms of grassroots?
I gotta leave. I don't know more. You guys got.
Yeah, this is more. I think this is
appointment,
more to Mark. But you talked a lot about grassroots work, and I've heard from a number of different people that the usual political playbook is kind of out the door. And I would just love to hear your thoughts on that, especially as we're trying to raise children's issues.
So let me just add to this question a bit to add a little texture to it. Last year at the Aspen Philanthropy Group, this was before the elections, so these are leaders of foundations, we posited that there are a few issues that have such clear bipartisan support. It doesn't matter which candidate gets elected, that person will have the opportunity to have an early win and to demonstrate that he or she could work across the aisle. And the number one issue on that list was early childhood development. Where does it stand now?
So I think you see the budget that actually just came out of the House yesterday has small increases in Head Start funding, Child Care Development Block Grant funding. These are small percentage-wise funding. And the budget that was approved just a month and a half ago on the federal level actually had increases in these investments in early ed. They're not big, and as you know, Head Start reaches about half the kids. It's now under half the kids that are eligible. Early Head Start reaches about 5%, actually less than 5% of the kids that are eligible. So, I think there's obviously change every 4 to 8 years in Washington. There's turmoil. There's, particular turmoil now because a lot of the structures with both Republicans and Democratic administrations are unknown and new players in there. So there's a lot of anxiety in Washington. But you see across the board that working with Congressman Cole, who's very conservative from Oklahoma, is a huge advocate on behalf of early ed investments. Senator Blunt from Missouri, very strong on these things. I talked to him last week, and they're leading the charge from their caucus to invest in these programs. So it does have bipartisan support. And that's true in state legislatures as well. New Hampshire, Governor Sununu, there's Republican state legislature, they pushed this new investment on all-day kindergarten. So despite what you see, these stories don't get told because they're not sexy and glamorous, they're not fights, they don't get a lot of press, but there is progress going on there. If you ask Congresswoman Rosa DeLauro, who's the head of the minority charge and the appropriations subcommittee, it's never enough. but Congressman Cole they're moving it forward. And they yell at each other, but they're moving the ball forward.
And there's a lot of history of bipartisan support.
Yep.
The Child Health Insurance Program
Yep.
was Senators Hatch and Kennedy.
Yep.
Support for a lot of basic fundamental safety net programs have all had bipartisan
Yep.
support.
Yep.
What's ominous to me is not the House budget, which does have these little incremental increases, but what came out of the White House a couple of months ago as their proposed budget was terrifying in terms of
Right.
major cuts to basic safety net programs and
Right, but
domestic
that,
programs in
as
general.
you know, the House, or the,
I know it's just a suggestion, but
it's
yeah.
a suggestion, so there, you got to do the work in the legislature. To your question about efficiency, I mean, effectiveness, I just go back, Save the Children runs Head Start programs that the federal government asked us to run because in very poor rural communities, you have to subsidize the money that the feds give you with private sector money because you can't afford to do that work. And the programs were not having great results. So I think, there's an ongoing issue, and Billy said it. Are they as good? Is every Head Start program as good as it should be? No. My father started Head Start, and I've said that publicly before. But the overall evaluations show great progress in that area. Are there some that are not as well run as others? Yes. Is SAVE now picking up some of those? Yes. Are we doing a better job? Yes. Could we do better? Yes. It's like any business, right? The question is you can come up with any statistic and say throw the whole system out and not invest in early childhood education, and then I'm going to come back and say to you, great, kid living in poverty at 4 years of age is 18 months behind my kid. We're going to spend billions of dollars trying to remediate that kid. In most cases, we're not going to do it, and we're going to spend billions of dollars putting that kid in jail for the rest of their life. I mean, that's a gross generalization, but you're going to have health issues. You're going to have all of those issues that are out there. So to me, we got to get fired up and say, this is the right way to go. Could we do it better? Yes. Could we use the brains of smart venture capitalists, which a lot of you are, or smart deliverers of service? Yes. Pittsburgh Children's Hospital, they got a lot of juice in Pennsylvania.
Yeah.
Get out there and, wow, if we could use you guys on an ongoing basis, that's fantastic. And if you're a great communications person, you made a lot of money doing it, you could help, sharpen that message.
I think the biggest change politically that we'll experience is we've had the luxury of being mostly on offense for the last number of years, and now we're going to have to build in some defense, whether it's Medicaid cuts or food stamp cuts or what have you. And so we're just going to have to develop a team that plays defense as well, and that will slow us down in some places. But there's also a pretty strong chance, as the last 6 months or so have demonstrated, that not a lot is going to happen, and that I think anybody who was originally thinking they were going to, for example, be able to cut the food stamp budget has not been emboldened by the competence of the current administration.
So I'm going to end by asking you your greatest aspirations and start with mine, and that is that every 5-year-old enter kindergarten at the same place. Able, with that capacity to grow, with that capacity to learn, with that resilience that allow them to succeed through life, and that it'll be on merit. So that's what's yours?
I would only add to that we develop the ability to project our voices and theirs so that can happen. It's really I can't emphasize enough how absent these voices are and this point of view from most public policy conversations. And I think philanthropy is critical, money is important, but developing that voice, getting as close to the issue as you possibly can, going to bear witness, seeing and letting yourself be moved by what you see in a classroom or in a clinic or in a hospital is going to, I think, make your voice all the more powerful.
That was beautifully said. And I guess I'll just summarize. We want to be the NRA for kids. And we want to have that same sway, which is what you're saying, in the political system. I mean, Save the Children does work on kindergarten readiness and making sure that kids are reading at grade level by the end of 3rd grade, because those are 2 huge indicators. And there are other cradle to career milestones that need to be met. We focus on those first 2, which is really the first 8 years of life, and then developing, as Billy just beautifully said it, the capacity to be engaged in educating, but also holding folks accountable. Yeah. Because honestly, it's discouraging when you have 5 people in this room say they only give on political money around kids, when if everybody raised their hand, we'd be doing what you just eloquently said. I mean, we'd be one step closer.
So those are process issues to get, in essence, what Jane said. And I accept and totally endorse, without edit, what Jane aspires to. I think that is, in fact, the most important priority for America by far. And if we could accomplish that, I think it would pay off in ways. It's not just ROI, it's impact of investment. It's about the lives of children, and it's about ensuring that America remains resilient, viable, and influential in a very, very complex world that's getting more challenging and more complex. If we could do what you just said, we could rest easy that at least we had a shot at remaining as resilient as America needs to be in the world. Thank you for stating it that way.
So please join me in thanking this panel.